Now, for the next type of drugs, which we are basically trying to look at their applications, um, applications in treating acute rheumatic fever is a sedative drugs, right? But the sedative drugs, well, I would say that uh, if you're using a sedative drug, that's basically a drug that will put someone to sleep, right? So to me, um, if you want to use a sedative drug, yeah, put the patient to sleep. So you mostly use it when the disease condition has started actually involving the nervous system of the patient, right, leading to all those sedation and chorea. So let's look at the types of drugs that are mostly effective at this time. So they are not the primary treatment of acute rheumatic fever, you should note that, but of course you can use them to manage all those abnormal movements of the hand and all of that is usually associated with acute rheumatic fever. So but primarily you should know that acute rheumatic fever, the treatment is cycled around trying to eradicate the streptococcal infection. Okay, so mostly use antibiotics, anti-inflammatory drugs and all of that. Sedatives, you basically use it if the patient is restless or the patient is having difficulties in sleeping. Do you understand? The patient is anxious or agitated. So common drugs you use is drugs like diazepam and hydroxyzine. Okay, so that's what we have. Okay, so other ones: phenobarbital, diazepam, chlorpromazine, haloperidol. Okay, these are the drugs you use if you want to put a patient to sleep in acute rheumatic fever.